Alisha, and just a little brief introduction. I just wanted to talk about how we met. We met on social media, kind of. Obviously, social media is great for connecting with people that you may not know and forming relationships in real life.
Yes.
And we also both happen to have our own brands. I'm a travel physical therapist, purposely traveling.
I'm a travel nurse, a nurse on the move. So we thought it would be a great plan, great idea just to merge ideas and also to talk about physical therapists and nurses, the relationship between the two, and not only the relationship, but how we can help each other, things that we don't like necessarily about each other, things that can be better. And, you know, what can make your job easier and how can I make your job easier?
Yeah. So first we kind of want to start by talking about the difference in education. With physical therapy, we have to obviously have a bachelor's degree, and then we go on to a doctor of physical therapy program, which usually takes about 2 to 3 years. So how about you guys?
Well, we don't have to have a bachelor's in nursing to be a nurse. But they're changing it so that more hospitals require you to have your bachelor's degree.
Okay.
So when people say they have a BSN, that means that they have a bachelor's in nursing.
I want to talk about, you kind of touched on it a little bit, about the different levels of nursing, because I am just totally confused. LVN, CNA, RN, whatever else. Confusion. So can you enlighten us a little bit more?
Funny.
Maybe? I don't know. Like, who is who? What is the level?
Okay, so CNA. Okay, that's kind of like the below the RN. So CNA stands for Certified Nurse Assistant. It also, I know other places that call CNAs aides, techs. Yeah. So basically the CNA assists the nurse.
It's kind of like light duties, I guess.
Light duties. That's what the CNAs do. Mm-hmm. But mind you, the nurse can do that too, though. You know, because some people go in nursing like, oh well, let the CNA do it. No, it's still your patient. Like, you still need to do that too.
I've had that issue before.
Yeah, if she's busy or if he's busy and you're not busy, don't just put on a CNA. You can do it too. Like, okay, RNs, you know what RN is. Mm-hmm. Registered nurse. So LPNs is like a licensed practical nurse. It's like in between the CNA and RN.
Okay, I'm getting it.
NP, you have your nurse practitioner, which is up there with the doctor, and I think that's all of them. So piggybacking off that, we have PT, OT, and don't they do the same thing? Like,
well, our fields kind of overlap a lot, but typically how I describe it is occupational therapy usually help with things like brushing your teeth, brushing your hair, putting on your shirt, putting on your pants, toileting, all of those like kind of fine motor kind of things, ADLs and things like that. And then with physical therapy, it's kind of a little bit bigger, I guess, like strength, walking, balance. But occupational therapy can work on all of those things too. So it's kind of like a bigger spectrum. And usually occupational therapy deals with the upper body mostly. Like, we have a lot of occupational therapists who work a lot with hands, like specialize in hands, because that's, you know, kind of an intricate area. So it kind of overlaps. And I know some really great occupational therapists too, so shout out to you.
And what about when physical therapists, you know, they come to the nurse like, you know, his blood pressure's a little low. I don't think I should get him up. His heart rate's high. Are you the doctor or are you the physical therapist? Because I'm trying to figure out.
Well, it's important for us to be aware of all those vital signs, because it happened to me once. This guy, he was on high flow oxygen, and I got him to stand up, and he started feeling a little bit dizzy. Checked his blood pressure. It wasn't that great, so I'm like, oh, you can sit back down. And the nurse was like, oh no, the doctor said you can get up and walk. They want him on his feet. Walk. I'm like, no, maybe later. I'll come back in the afternoon. Step out of the patient's room, get like 5 feet down the hall. Code. Same patient.
Wow.
Yeah, so I'm like, I'm so glad.
And it wasn't you that got him up. Somebody else got him up? Or?
Yeah, he tried to get himself up. obviously.
Said,
but it's still like I said no getting up out of bed. I walked away from the situation, but that could have been my fault if I did try to, walk that patient. So we just have to be aware because it's our license. We don't want to hurt anybody, so we just like to be aware.
So you all are taught like the normal vital signs, like when to not treat.
Yeah, we have to learn all of that stuff, vital signs, all that cardiopulmonary stuff that things to be aware of when you're working with people. So we just like to be on the safe side, very cautious. I am very cautious. Okay, I'm just gonna precede this statement by saying I love all nurses. You guys are awesome.
What's she about to say?
But I don't understand why if you see me struggling with this patient, trying to sit them at the edge of bed, why can't we work together on this? Why can't we, teamwork? You're in there. I'm like, hey, you want to help? Grab.
Oh.
And you're just like, patient, I gotta go. Sorry,
let me grab it.
Right. Like, nah. Like, can we work together?
No, I try not to do that, but when I think of physical therapists, I think, oh, y'all got it. Like, I've been with them all day. You don't need me. You good. You good.
You're going to lunch. Oh, they're in therapy at lunch. Yeah, that's usually what happens.
So what about when y'all get the patients to the chair, right?
Mm-hmm.
Get them to the chair. You gonna put them back in bed, or do I have to put them back in bed? 'Cause I didn't take them out of bed.
Well, we would like patients to be up and not just lying in bed all day. Obviously, I'm sure you guys would want the same thing.
Yeah,
so
yeah.
I don't know. Sometimes shift change. They just get left in the chair, and then. But I usually let the nurse know that I'm gonna leave this patient in the chair. If I'm not back, or if they want to get back in bed, just call me. Because usually we have a hospital phone, obviously.
Okay.
And if you call, I will come. But it does happen when they just get left in the sleep. That's all you know.
So what are some things, I guess, as nurses that we can do that kind of will help your job without doing your job, that will kind of like assist?
If I come to you and I say, hey, I want to see patient in room 10 in like 15, 20 minutes, could you have them, cleaned up, medicated, all this stuff, ready to go, and then I can kind of go from there. And then just kind of be available afterwards so I can let you know at least how it went. That would be helpful.
Okay,
Just be open to what we're trying to do. We're trying to help the patient too. And I know some nurses are just like, why do you have to tell me every time you're trying to see the patient? Because they could be, have a change in status from yesterday. Things change. So just be more open and just be nicer. Some nurses are a little mean to us. They are. Sometimes.
That's sad. I haven't been, but I've seen nurses be like mean to PTs, and I don't understand why.
How can we help you, nursing?
Well, for starters, let's put these patients back where you got them from, okay?
Oh gosh. Okay.
And
got it.
I don't have that much. I can say I do feel like some physical therapists are like overbearing, and they do they really try to be doctors. Like honestly, you could have just went to medical school. I don't know, but I think that's per person. So I don't have.
So we're perfect. Yes. That's great.
Who wants to help me clean up some poop?
I will.
PT?
I'm always
do you do
open
that?
because we can document that as you got to roll them. They have to bridge. They have to help. So we can kind of see how much assistance they need.
I am not PTs out there. Y'all need to start helping us clean.
Putting on gloves. Get it done because it has to be done. It's part of patient care. The patient's light is on. You don't just walk past it.
This is a good. I want to work with you.
Come work with me. I try to be helpful because we're all a team. And nobody wants to have a bad day.
I think that the physical therapist care is needed and it's appreciated, and we appreciate you if you don't hear it enough. Because there are some days that we literally do not have time to get our patients up. There's no time. We're running around, and then the physical therapist comes in, and that's one thing that we can check up our list of things that's been done. So that's awesome. And then there also physical therapists can tell me something about my patient that I didn't even know.
Right.
Because I haven't physically seen them get up or even sit up on the side of the bed. So now you're telling me something about my patient that I didn't know that they could do. So now I know that they can do that. So that's a great thing about physical therapy.
Yeah. So I think the overlying message is that we should be able to work together in harmony and, you know, just be more receptive to each other.
Yeah.
In the hospital setting or any other setting, nursing, home, wherever we're together. So Purposely Traveling is my brand that I started basically because I didn't see, whenever I started my journey into physical therapy, I didn't see a lot of people who looked like me. You know, even in school, I was the only Black girl in my graduating class. And so that was, you know, a bit of a struggle. So I kind of just wanted to see or have a face for girls or even guys who are pursuing this career, who just feel kind of doubtful about it because they don't know what it entails, or they're just not aware of it. Like, I didn't become aware of it until I was in college. So I just kind of want to get that information out there and kind of bring awareness to this profession because it's very rewarding financially and just, you know, emotionally. You help people literally get back on their feet. So here's one of my shirts and my merch, Travel Treat Repeat. I also wanted to bring awareness to Travel PT because I've been doing this since I graduated, and it's been really fun. So check it out, purposelytraveling.com.
That's actually very awesome. I like that. The reason why I started Nurse on the Move is because I just saw a lot of people started DMing me, and I literally was on the phone with this girl for 30 minutes just answering her questions about travel nursing, how I get into it, how long I've been working, and then just more people just started DMing me. So I was like, it's probably best for me to have a website to answer all their questions and have a contact form and have merchandise and just really praise women of color, men of color that are in nursing, especially travel nursing, or that love to travel in the healthcare profession, and to shed light on them. My main goal was to educate people about travel nursing and to promote traveling. NurseOnTheMove.com, PurposelyTraveling.com.
Check it out.
Check us out.
Big things.
What's your Instagram?
You can follow my personal Instagram, Dr.Witherspoon, and then Purposely Traveling is just my Purposely Traveling Instagram.
And my personal Instagram is RN_Alisha, and my Nurse on the Move Instagram is nurses, plural, on the move _. There's no underscore. Yeah, Nurses on the Move.
All right, so